Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Do you have a headache? We're going to talk about all the possible causes. And atrial fibrillation, or AFib, what causes it and what we can do about it. Also, we're going to look at some new cancer treatments, and we're also going to see how faith can help healing. All that, and the Bluegrass Parkinson's Alliance is here. My first guest to start us off is Dr. Hasanki Warnakula, who is a double-boarded in medicine and pediatrics, and you're the most recent addition to Family Practice Associates. Welcome.
Thank you for having me.
Now, you're going to be put on the spot to talk about headaches. So
yeah.
Give us an idea. There's multiple causes of headaches.
Yeah, absolutely. So like you said, there are so many different causes for headaches. You can basically break down headaches into primary headaches, which means that there are no kind of identifiable causes to them. So these would be, examples would be migraine headaches, tension headaches, and then there's also secondary headaches as well. So those are where there's other underlying reasons for the headaches. So things like meningitis, trauma, and other kind of infections that could cause headaches, tumors. Those are some kind of common causes.
All right, now you mentioned primary headaches with migraine and muscle contraction, but let's talk about migraine, because a lot of people say, I've got a migraine. We see TV, they're always advertising about migraine medicine. What is a migraine?
Yeah, so migraine headaches are usually very episodic. They can happen for some people on a daily basis. But some of the characteristic features are usually that they are unilateral, meaning that they occur on one side. They're usually associated with nausea, vomiting. Patients often have light sensitivity, sound sensitivity. They want to end up just going to a dark room and kind of turn off all the lights. For kids, though, it doesn't necessarily always have to be one-sided. For kids, it actually can be bilateral or just kind of across the head.
Are there any certain risk or people that are predisposed to migraines?
Yeah, so genetics can play a factor into it. If you have family members who have migraine headaches, then you are more likely to have migraines as well. Oftentimes I have seen that patients have parents or other family members who did have migraines but were never formally diagnosed with it, but they do recall having times where their mom would go into the room and be saying that they just need, a dark room, no one talk to me, and that was probably a migraine headache.
But if that takes care of the headache, do you need to go to the doctor, or if you go to the doctor, what can you expect?
So it depends on how often they're happening. That would be one reason. The second reason is we don't want to just land on and say that this is a migraine headache when there's so many other possible causes. So that's the reason to go to the doctor.
To rule out anything that might be treatable or reversible.
Correct.
So treatment. There's some new stuff out there, or relatively new for migraines. Works pretty good.
Yeah. So typically the first line, if they're very infrequent, would be to try NSAIDs, so things like Aleve or ibuprofen. But sometimes those don't work for patients. And so then a lot of patients have tried a class of medications called triptans, so things like sumatriptan or Imitrex. But in the last few years, we actually have a new class of medications called CGRP antagonists, and those would be things like Ubrelvy or Qulipta, and those actually are much better tolerated, so they have fewer side effects, and they can actually both help prevent migraine headaches, and they can also treat when the headache actually occurs as well.
One thing before we wrap it up here is I'd like to touch on a headache that can mean meningitis. What are some red flags that you say, man, I really need to go see a doctor about this?
Yeah, so if you have a headache that's also in the setting of having fevers or a change in mental status where you're kind of slower in your cognition, if you're not waking up very well, if you notice your family member is not waking up, and any sort of other infectious symptoms that go along with the headache, that would be a reason to come in and see the doctor.
All right. Well, thanks for coming in. Thanks for all the care you give the patients, and we appreciate it.
Yeah, thank you for having me.
All righty. We'll be right back.